And usually the first line is medication, specifically drugs called dopamine agonists.
Ah, connecting back to the dopamine break idea.
Exactly. These drugs basically mimic dopamine's action on the tumor cells. They bind to the dopamine receptors on those cells and tell them to stop overproducing prolactin. And importantly, they often shrink the tumor, too.
Which drugs are used?
The preferred one nowadays is usually cabergoline. It tends to be more effective, lasts longer, so you don't have to take it as often, maybe just once or twice a week, and generally has fewer side effects.
Okay.
An older option is bromocriptine. It still works, but often needs daily dosing, sometimes multiple times a day, and it's more likely to cause side effects like nausea or dizziness. But it's still used, sometimes for specific reasons, like during pregnancy planning.
So the goal is lower prolactin, shrink the tumor. How do you know if it's working?
Regular monitoring. Blood tests to check prolactin levels, usually every few months initially, then maybe less often once stable. Repeat MRI scans might be done maybe after 6-12 months of treatment, especially for macroprolactinomas to see if the tumor has shrunk. Or sooner if symptoms aren't improving or are getting worse.
These drugs sound pretty effective. Is medication usually enough? Or is surgery common?
For most people, especially with microprolactinomas, medication is highly effective and might be the only treatment needed. Surgery comes into play in specific situations.
Such as?
Well, if the drugs don't work well enough, if prolactin levels stay high, or the tumor doesn't shrink significantly, or if someone just can't tolerate the side effects of a medication, even at low doses. A more urgent reason for surgery is sudden, severe vision loss from a large tumor pressing on the optic structures. Surgery can relieve that pressure quickly. And sometimes, rarely, if a tumor shrinks dramatically with medication, it can cause a leak of cerebrospinal the fluid around the brain, which might need surgical repair.
How do they actually do the surgery? Through the skull?
No, usually not. The standard approach is called transsphenoidal surgery. They go through the nose and the sphenoid sinus at the back of the nasal cavity to reach the pituitary gland.
Wow, through the nose.
Yep. It could be done using either a tiny camera on a thin tube that's endoscopic surgery or using a microscope. It avoids needing to open the skull. Success rates are pretty good, especially for microprolactinomas, maybe around 90% cure rate. For macroprolactinomas, it's a bit lower, closer to 50% because they can be harder to remove completely.
Okay.